As you prepare for your joint replacement surgery, Rehab Services will play an important role in your procedure and recovery. During your recovery, following surgery, you will have both physical and occupational therapy. Therapists and/or therapist assistants will work with you on learning how to move safely and care for your new joint replacement during your hospital stay. The rehab team will also educate you on any recommended adaptive equipment needed for your care at the hospital and at home. For optimal results after your joint replacement, early activity and exercise is critical. Therefore, the role of therapy is to get you up and get you moving. Occupational therapy will focus on activities of daily living such as dressing and bathing, along with recommending any adaptive equipment that you may benefit from. Physical therapy will focus on bed mobility, transfers, ambulation, stairs, range of motion, and strengthening. We'd like to say that this joint replacement becomes your new full-time job. If you focus on doing your exercises, going for walks, and participate in your therapy sessions, you will improve your outcome. Please remember, you are personally accountable for 50% of your final outcome. It is your responsibility to help achieve your goals and expectations. Your recovery is all about what you do to keep moving. Your joint will be better than it was before surgery, and it will need your personal touch to fully recover. Most likely you will need a walker after surgery. Therapy recommends a walker that has straight wheels. There are walkers that have swivel wheels. However, these wheels move more freely and may not provide you enough support. There are also walkers without any wheels. However, these walkers you would have to pick up with each step. If you already have a walker or are able to borrow a walker from someone, you can bring it to the hospital for the therapy staff to make any adjustments. Therapy will adjust the height of the walker to the appropriate height for you and will look it over to make sure it is working properly. There is a possibility you may progress to crutches prior to discharge if your therapist feels you can use these safely. Your therapist will recommend what they feel is the best assistive device for you. Your surgeon may use a CPM machine if you have a knee replacement. CPM stands for Continuous Passive Motion. The purpose of this machine is to help achieve and maintain good range of motion following your surgery. The CPM will move your knee through the designated range. While the CPM is on, all you need to do is relax and let the machine do the work. Someone from the company will call you and deliver it to your home prior. They will set the CPM up for you so it fits you properly and show you how to use it. You may see a few different pieces of medical equipment like a knee immobilizer. Knee immobilizers are braces that may be ordered by your surgeon to stabilize your knee. It also helps by keeping your knee from bending. There are times therapy will have you walk with a knee immobilizer on if there is a question on your muscles' ability to control your knee. These sturdy belts are used by staff members when you get up and move. Another safety device, these belts are used to help assist you in regaining your balance if you were to lose it or begin to fall. They also help you stand or transfer if you are too weak or groggy after surgery. Your bed will likely have a trapeze on it when you return from surgery. By pulling on it with your arms, you can reposition yourself in bed without having to use your legs. ICD stands for Intermittent Compression Device. These will be placed on your lower legs to help prevent blood clots. They should be worn 20 out of the 24 hours a day. They are portable and can be used when walking. They will be used for 14 days after surgery. Following surgery, you will recover in the hospital and work closely with your entire team to determine the appropriate day for discharge. Pain after surgery is a normal body response. It is our goal to minimize and control your pain as much as possible. However, your pain needs to be at a level that allows you to do your exercises and therapy. This is called functional pain. Functional pain is described as pain that is not gone, but controlled enough that allows you to function during exercise, ambulation, and your recovery. The goal is to minimize and control your pain. Pain goal is 4 to 5 on a scale of 1 to 10. That afternoon or evening, the nursing staff will assist you with sitting up. The nurses will have you sit at the edge of the bed while they monitor you for any blood pressure issues, dizziness, and if you're nauseous. There are occasions when surgery happens early enough in the day. Physical therapy may come in on surgical day and get you started with some exercises, bed mobility, and/or transfers. The morning after surgery, therapy staff will come in. We are typically in your room early the next morning. First, therapy will work on a few exercises that will be discussed later in more detail. Therapy will work with you on bed mobility to get you sitting up at the edge of the bed. Therapy, too, will assess for feelings of dizziness, nausea, and may check your blood pressure. As long as you tolerate sitting at the edge of the bed, therapy then will have you try to stand up for the first time using a walker for support. In order to stand, first therapy will have you scoot to the edge of the bed so your feet are flat on the floor. Then prior to standing, you will place your surgical leg out in front of you. This helps to avoid increased pain by decreasing the bend of your knee. Once sitting with your surgical leg out in front, then we will have you attempt to stand. Therapy will have you push up from the bed using your arms to assist. You never want to start with your hands on the walker, trying to pull yourself up because the walker could tip backwards. This could cause you to lose your balance during mid-transfer, causing you to fall. This could lead to an injury. Once standing, you could move your hands onto the walker and slide your surgical leg to the other leg to get yourself in a good stance. At this time, if needed, therapy will adjust your walker to the appropriate height. Fitting the walker to the height, therapy will have you stand with good posture. Therapy will adjust the height of the walker to be at your wrist level. If your walker is not available for therapy to adjust, they will provide you with education on how to make the correct adjustments prior to your discharge. Once the walker is at the appropriate height, therapy will have you do a couple of weight shifts prior to taking some steps. A weight shift is shifting your weight onto one leg and then back to the other. You may not have 100% feeling back in your surgical leg yet, so therapy would like to assess how you tolerate this before taking some steps. Therapy wants to make sure that your legs will fully support you. As long as you are able to stand safely, then therapy may have you take a couple of small steps to turn. To turn, you will hold onto the walker and take small steps, turning until you are lined up in front of the chair, which is placed beside your bed. To make sure you are lined up in front of the chair, you should feel the chair on the back of your legs. It is important to take small steps and not pivot on your surgical leg. Prior to sitting down, you will place your surgical leg out in front of you again, just like you did when you stood up. You then will reach back for the armrest and slowly lower yourself into the chair. Just like standing, you do not want to sit with your hands on the walker because, again, the walker may tip back and cause you to lose your balance with an uncontrolled descent, placing you at a higher fall risk or injury. Once therapy sees that you can safely transfer to the chair, you will get up for all 3 meals. Therapy recommends that you do not sit up for extended periods of time, as this could cause you to get stiff and increase your swelling. After meals, nursing staff will assist you back to bed and place the CPM on your surgical knee if ordered by your surgeon. The CPM will start at 0 to 45 degrees range of motion of the knee and will gradually be increased a few degrees daily. It will be increased based on your tolerance. You will be placed in this machine for 2 hours increments 3 times a day for a total of 6 hours, ideally between meals and evenings. The CPM does not count as your prescribed exercises. Therapy will come back to review morning exercises, and then we'll start helping you walk based on your tolerance to ambulation. Therapy will take you through a several gait or walking patterns. You will have therapy up to 2 times a day. Therapies will progress you daily in your bed mobility, transfers, ambulation, exercises, and stairs prior to discharge. Detailed information and exercises will be addressed later. Occupational therapy staff during your hospital stay will assist you in independence with activities of daily living. They will also evaluate your ability to perform these tasks and begin instructions on any special techniques and any recommended equipment you may benefit from for completing self-cares, including bathing, dressing, toileting, without risking damage to your new joint. Remember, up with the good, down with the bad. Prior to discharge, therapy will educate you on how to do the stairs. Therapy will have you go up and down the stairs to simulate your steps at home if applicable. After a surgery, you will likely need to take the steps one at a time, which is what some of you may already be doing. We have a golden rule that we tend to follow when going up and down the steps. It is up with the good, down with the bad. This means when you take the first step up, you will lead with your good leg first. This is your non-surgical leg. Going down the steps, you will lead your bad leg first. This is your surgical leg. Remember, one step at a time until your therapist tells you different. After you have knee replacement surgery, you will need to be careful about how you move your knee. Follow these precautions until your surgeon tells you they can be discontinued. Do not sit in the same position for long periods of time. Keep your feet and knees pointed straight ahead. Do not turn your leg or knee in or out while sitting, standing, or lying. Your knees should be either stretched out or bent in a way your therapist has instructed. Do not pivot on your surgical leg. Take small steps when you are turning. Your toes should be pointed straight ahead. Do not place a pad or pillow behind your knee when lying down. It is important to keep your knee straight when resting. If you need to rise or elevate your leg, keep your knee straight. Do not jerk or jump on your surgical leg. Do not kneel on your surgical leg. Do not squat soon after surgery, such as do not squat down to pick up something off the floor. Remember, to sit in a firm chair with a straight back and armrest. Avoid stools, sofa, soft chairs, rocking chairs, and chairs that are too low. Your hips should be higher than your knees when you are sitting. Sit on a cushion if you have to. As mentioned earlier, when getting up from a chair, slide towards the edge of the chair, place your surgical leg out in front of you, and use the arms of the chair for support when transferring from sit to stand. You will be discharged from the hospital when your healthcare team feels you are medically ready and you have successfully met physical and occupational goals. Goals for independent safe discharge are as follows. Understand all precautions and safety concerns. Understand and be able to do your home exercise program. Get up and down from a chair or toilet safely and independently. Walk on level surfaces using a walker or crutches as needed. Do self-care tasks using adaptive equipment if needed. Walk up and down steps using a banister or assisted device. Learn to not pivot on your operated leg. Once discharged, physical therapy most likely will be recommended. Physical therapy can continue as an outpatient, home health, and short-term rehab. Outpatient therapy, if you are returning home and have a support team in place, your surgeon may recommend you to continue your physical therapy on an outpatient basis. If you qualify for home health services, they will come and provide therapy within your home. It is up to the agency if you qualify and how many times a week they will provide therapy. Short-term rehab facilities provide daily skilled nursing care and rehab programming all under one roof. This is ideal for people that don't have enough care support in the home. Short-term rehab provides an option for recovery until you are able to safely return home. You will receive therapies 1 to 2 times a day, 5 times a week if you meet the skilled requirements. To build your strength and to aid in your recovery, start doing all of your rehab exercises starting today. This will allow you to become familiar with them, which will help you during your therapy sessions. Encourage your support person to go through these exercises with you as they may need your help after surgery. There will be 4 exercises that therapy will introduce to you most likely the day following surgery. These exercises help keep the blood flowing in your legs, reducing your risk for blood clots. They also help keep your swelling under control by pushing the fluid out of your legs. During your therapy sessions, the therapist will provide you with education and assist you with your exercises to make sure they are performed correctly that day. Each day, your therapist may introduce different exercises to progress you in your range of motion and strength. Your therapist prior to discharge will provide you with your own personalized home exercise program. The first exercise is ankle pumps. Position. Begin lying on your back with your legs straight. Movement. Slowly pump your ankles by bending and straightening them. Helpful tips. Try to keep the rest of your legs relaxed while you move your ankles. The second is supine quad sets. Position. Begin lying on your back on a bed or flat surface with your legs straight. Movement. Tighten the muscles in the thigh of your surgical leg as you straighten your knee. Hold for 5 seconds, then relax and repeat. Helpful tips. Make sure you keep your toes pointed towards the ceiling during the exercise. Try to flatten the back of your knee towards the bed. The third exercise is supine glute sets. Position. Begin lying on your back with your legs resting comfortably. Movement. Tighten your buttock muscles, holding for 5 seconds, then release and repeat. Helpful tips. Make sure not to arch your low back during the exercise or hold your breath as you tighten your muscles. Keep your knees flat. The fourth exercise is supine heel slides. Position. Begin lying on your back with your non-surgical leg bent and your surgical leg straight. Movement. Slide the heel of your surgical leg towards your buttocks, bending your knee as far as it is comfortable, holding 5 seconds, then sliding it back to the starting position and repeat. Helpful tips. Make sure to keep your back flat on the bed during the exercises. These are the 4 main exercises that therapy will begin with you. The following will be introduced as you tolerate them. Supine hip abduction may require assistance from your therapist if you are unable to move through the completed range and/or perform correctly. I will describe this exercise today with assistance. Most likely, the therapist will need to assist you to achieve the available range and for proper form with this exercise. Position. The patient should be laying on their back. The therapist or caregiver at home should hold the surgical leg above the knee and at the heel. Movement. With assistance, slowly slide the surgical leg out to the side, keeping toes pointed towards the ceiling. Hold for 5 seconds. Then slide the leg back to the starting position. Helpful tips. Make sure to perform this exercise slowly and keep the knee straight but not locked. The caregiver should keep their back straight to maintain good body mechanics. Do not force range and always go by pain tolerance and assess their body language for any signs of discomfort that they are not sharing. Caregivers are there to assist in this motion that you are unable to perform correctly. They are not there to do it all, unless instructed to. This exercise, position, movement, and tips will be the same if you can actively do these in good form on your own. Initially, straight leg raise most likely will require assistance from your therapist during your hospital stay. I will describe this exercise today without assistance. Position. Begin lying on your back on a bed with your surgical leg straight and the other one bent. Movement. Pull your toes towards your body, keeping your knees straight, and slowly lift your surgical leg off the bed until it is close to parallel with your other thigh. Hold to your tolerance up to 5 seconds, then lower it back down to the starting position and repeat. Helpful tips. Make sure to keep your thigh muscles tight and your knees straight. Do not turn your foot or hip in or out during this exercise. When assistance is needed, the therapist or caregiver will hold your leg above the knee and at the heel while assisting. Remember, exercises should be completed within your pain tolerance. If your caregiver is assisting, they should also be monitoring your body language for any signs of discomfort that you are not sharing. Exercises should be completed slow and with control. Caregivers are there to assist in the motion that you are unable to perform correct. They are not there to do it all unless instructed to. Short arc quad. Position. Begin lying on your back with a towel under your knee of your surgical leg with your heel resting on the ground. Movement. Tighten the muscles of your upper leg to straighten your knee. Hold up to 5 seconds, then return to the start and repeat. Helpful tips. Make sure to keep your back flat against the floor as you move your knee. Calf stretch. Position. Begin lying on your back, holding the end of the strap or sheet that is looped around your foot. Movement. Slowly pull back on the strap or sheet, pulling your toes towards your body, and hold for 60 seconds. You should feel a stretch in the back of your lower leg. Helpful tip. Make sure to keep your leg straight and do not let your foot turn outward or inward during the stretch. This will help to achieve full knee extension, getting your knees straight. It is important to have your knee straight as it is for it to bend. This will help you with your gait mechanics during your ambulation. Knee extension stretch with chair. Position. Begin sitting upright with a chair directly in front of you. Movement. Rest your foot of the surgical leg on the chair and then begin to relax your leg, allowing your knee to straighten and hold this position. Helpful tips. Make sure to keep your back straight and keep your foot pointed towards the ceiling. Do not let your foot roll out or in when you are doing this stretch. This will help you achieve full knee extension. It's just as important to have your knee straight as it is for it to bend. This will help you with your gait mechanics during ambulation. Seated knee flexion stretch. Position. Begin sitting in an upright position with your feet flat on the ground. Movement. Slide your surgical leg backward and as far as it is comfortable, holding for 60 seconds. Then slide your foot back to the starting position and repeat. Try to slide your foot a little bit further each time. You may want to use your opposite leg to assist with increasing your stretch. Helpful tip. Make sure to keep your back straight during this exercise. Do not force the stretch. Stretch within your tolerance. You will have some discomfort, but not so bad that you have increased pain following limiting your activities of daily living. This will help you achieve full knee flexion. It's just as important to have your knee to bend as it is for it to be straight. This will help with your gait mechanics during ambulation. If you have steps with no railings, therapy encourages you to have at least one railing installed. 2 would be ideal if possible. Having railings with your stairs will make it easier to enter and exit your home. Remember, up with the good, down with the bad. If your bedroom is upstairs, consider using a main floor room for a bedroom initially. Traffic pattern. Move obstacles such as throw rugs, extension cords, footstools out of your walk. Create a wide, clear path from your bedroom to your bathroom and kitchen so you can easily move about with your walker. Bathroom. Install a raised toilet seat in the bathroom if you're unable to get on and off the toilet easily. Grab bars, tub rails, and a shower chair may be beneficial as well. Install non-slip surfaces in the tub and shower. Find a chair to sit in that has a firm, straight back chair with armrest. A dining room chair may work if you don't have others. To avoid reaching or bending, keep frequently used items within reach, especially in the kitchen, bathroom, and bedroom. In case you cannot wear pants with pockets when you first return home, consider getting an apron with pockets so you can carry around your phone and or other items after surgery. If you are using a walker, attach a walker bag to the front of the walker to carry items from place to place. It is a good idea to carry a cell phone or a portable phone with you at all times during surgery. Get help with cleaning and laundry when you first return home. Have a few weeks' worth of clean clothes available to you. Small children and pets can pose a safety hazard to your recovery. Small children may need to be taught how to interact with you in ways that keep you safe. If you have pets, make arrangements to keep your pets in another area of the house when you arrive. Arrange someone to collect your mail or place delivery on hold during your stay at the hospital. Arrange for help with meals and perishable foods. Prior to surgery, freeze pre-made dinners and other meal items. Stock up on non-perishable foods to make it easier to prepare meals after surgery. You can also call your local Aging Disability Resource Center to see if you qualify for Meals on Wheels. Arrange for someone to drive you to your appointments after surgery. Do not drive until your healthcare provider says it's okay. Break up long car rides. Stop, get out, and walk about every 2 hours. You may need to move your seat back and sit on a firm cushion to make it easier to get in and out of your car. Make sure to wear shoes with backs on that can easily be slipped on and off. Do not wear clogs or sandals. Use your walker until your doctor or therapist tells you it's okay to stop using it. Your therapist usually starts you with a front-wheeled walker during your hospital stay. When you are strong enough, your therapist or doctor will transition you to a wheeled walker, crutches, or cane. Once again, please remember, you are personally accountable for at least 50% of your final outcome. It is your responsibility to help achieve your goals and expectations. Your recovery is about what you do to keep moving. Your joint will be better than it was before your surgery, and it will need your personal touch to fully recover. In summary, we talked about a lot of things. We talked about making sure your pain is under control and what to expect during your hospital stay with therapy. We talked about making sure you have the right walker and getting your home set up prior to your surgery. We talked about your knee precautions. And we talked about the importance of the exercises and how you need to start them today to become familiar with them and to increase your strength and range of motion prior to your surgery. Therapy would like to say that this joint replacement becomes your new full-time job for the next few months. If you focus on doing your exercises and going for walks, this will improve your outcome. Work or home activities should not replace your exercise program. And you are getting this new joint replacement because you want a good outcome, right? So make sure you do your homework. Mile Bluff Medical Center Rehab Department is looking forward to helping you meet your goals. Good luck to you all.